if you're genetically predisposed to gain weight. Joining me now is chiropractic physician and acupuncturist Dr. Cathleen Gerenger, and you actually did genetic testing.
Yes, on myself, of course.
And so what'd you find out?
It's really interesting because I never thought myself as being a snacker. And the reason why is that because I don't really snack on stuff. However, when I genetically test myself, it shows up that my genetic predisposition shows that I am a snacker.
Interesting.
Yes.
And you also showed that your rebound weight. So a lot of people can lose weight and keep it off, but there are other folks that can lose weight, and if they don't try really hard, it comes right back.
Absolutely. So that gives us like an insight of how we're going to modify our weight loss to prevent that rebound weight gain. So in my position, what I need to do is make sure that my thyroid, my hormones are nice and balanced, and really dial in on that rebound weight gain by not overeating.
So you're saying that when it comes to losing weight, it's not a one-size-fits-all approach, that genetic testing could actually help you know the roadmap that's good for you.
Yes, it gives us a blueprint. If we know what our blueprint is, we're able to turn on or off those genetic predispositions.
And it also seems to be that genetic testing, because I've done it myself too, can also give you a window into your health, because my genetic test showed me that, you know, my parents were both at high risk for heart disease. That's pretty prominent in my family. So very early on, I changed my diet, I changed my workout routine. There's so many things that you can do to be an advocate for your own health just by knowing your genetic, you know, makeup.
Exactly. Just like everybody's like, oh my gosh, I have those obesity genes, I have those fat genes because my family all are overweight. I was like, but you're able to control it. You just have to work a little bit harder.
Many, many moons ago, I had the honor to do like an Ironman health screening, you know, the famous triathlon. And there are also ways to find out like the best workout. So I'm not a good like runner, but I'm very good with anaerobic exercises, which is why I like boxing so much. You go hardcore and then you go stand in your corner, hardcore in your corner. So you can even figure out what works best for your body when you want to exercise.
Yes, we can genetically test that too. So unfortunately for my genetic makeup, which is so unfair that I have to do both. I have to do aerobic and anaerobic exercise. Like those high intensity training exercise is what really helps me from preventing that rebound weight gain.
So, and you're really big on just knowing everything about your body when it comes to overall health. It helps us with our weight loss. It helps us with knowing like what workouts are best, but it also tells us what we should be eating and how we should be living our lives.
Yes, and it actually, if you take a step further, we can actually use that roadmap to anti-age ourselves. Like on my test, it shows that I have a high insulin sensitivity, so I'm insulin resistance, even though it doesn't show it yet, but that means that whatever I have to do, I have to make sure that I don't overload my body with too much carbs or sugar.
Interesting.